Barbara Philpott is a bit of a fitness buff. Workouts are important to her, but repeated bouts with mysterious infections kept threatening to sideline her.
I had abdominal pain, and I'd have days that I ran fever. I'd be in bed, and then I'd go in and they'd say, "You have a UTI," and they'd put me on antibiotics.
This went on for 5 months until finally a CT scan was ordered.
And the day after it was performed, the doctor called me with the diagnosis of diverticulitis. And not only did I have diverticulitis, but the colon had ruptured, and I had pockets of infection on the outside of my intestines.
Barbara was referred to Central Florida Regional Hospital. The infection from the ruptured colon had to be treated, but she would ultimately need surgery. Her surgeon decided to perform robotic surgery using the Da Vinci.
Essentially, it's another tool in minimally invasive laparoscopic operations. And I think you can kind of tailor it to whatever surgery you need to do.
The Da Vinci is capable of very fine movements, which means smaller incisions and less invasive surgery. Surprising considering the Da Vinci looks rather imposing.
The Da Vinci robotic system is humongous, but it all channels down the arms, and ultimately your instruments are basically about the width of my pinky. Maybe just a little bit wider depending on what instrument you're using.
Actually, I was pleased to know that they were going to be using that type of technology, because I was aware that it was going to decrease the amount of openings in my wife's body that were going to be created because of the Da Vinci.
You might think walking would be out of the question for a while after having 10 inches of colon removed, but Da Vinci-assisted surgery promises a faster recovery. In fact, Barbara was up and walking by 7 o'clock that night.
What I've been surprised is, even from regular laparoscopy to Da Vinci assisted laparoscopy, I've noticed an even shorter length of stay in between those two arms. You wouldn't necessarily think that going into it. You think, well, both methods are minimally invasive, but I've noticed even 24-hour shorter length of stays with the Da Vinci technology.
The first week we were home, my husband and I walked twice a day. We did a half a mile morning and night. The second week we increased it to a mile, and by the third week we were walking 2 miles.
Barbara was home within 2 days of her surgery, but the Philpotts say even with such a short stay, the level of care shown by the entire Central Florida Regional Hospital staff was impressive.
We look at this hospital, and I've told the hospital staff, that it's sort of our hospital. Our grandson was born there. I've been admitted there a couple of times. When we've had emergencies, we've gone there. We've always had a comfortable feeling and a good experience by going to Central Florida Regional.